Welcome back. You're watching a special programme on the coronavirus outbreak. Time now for us to try to answer your questions on COVID-19. Joining me are the urgent care doctor, Kishan Rees, and Simon French, who is chief economist at Panmure Gordon. Simon, before we get on to the viewers' questions, very briefly, how serious is what we've witnessed today and how long does it last? Well,
in the context of financial market moves, it's the biggest one-day move we've seen in more than 10 years. How long does it last? Well, today was a fear event. What was basically happening is traders said, we can't really price the COVID risk. We're not quite sure. There was an oil story going on between Saudi Arabia and Russia. And until that can be priced more narrowly, this is going to be quite open-ended. This will go for some time.
Yeah, OK. Right. Now, questions from viewers. Kishan, this one's for you. Mark from Wiltshire. Does COVID-19 actually cause permanent damage to the lungs, or will an infected person completely recover from the damage caused? Quite a good question.
Sure, no, it's a great question. And I think with the wall-to-wall media coverage, it's very easy for this to potentially be blown out of proportion. So it is, of course, serious in terms of as a disease and the way that it's spreading around the world. But I would like to reassure patients as much as possible that for the vast majority of people, it will be a mild, minor illness and they will recover and that will be fine. Obviously, for the more at-risk groups and the people with pre-existing respiratory diseases or chronic diseases, if they ended up on ITU and ventilated, then the chances of that recovering back to normal is obviously less. But it's really worth emphasising that it's a very small proportion of people, and the most important things people can do is take steps to protect themselves and others. So that is wash hands, that is good hygiene. As we're seeing on London Underground at the moment, behaviour is impeccable. There's less people, and people are actually washing their hands, not sneezing all over people. So I think that's really important as well.
Yeah. OK. Simon, I mean, it's the first day we've had a lot of questions on the stock markets and as well as health. So this is one. Should I panic if I'm drawing a pension in 5 to 10 years' time?
Well, panic is never a good emotion if you're planning for your retirement. Certainly if you're looking on a 5 to 7 year horizon, the likelihood is, when you look at stock market return charts over many, many decades, events like this, which feel very, very, can generate much anxiety in the short term, are rarely seen as more a blip on an upward trend. And therefore, I would suggest, if you haven't got a near-term event where you're going to need to tap into that pot of money, then just sitting this one tight, seeing how it evolves, seeing how the economics evolve, because at the moment, some of the very, very sharp moves in prices are based on fear. And that, at some moment, will start to pass and be able to reprice this more accordingly.
Yeah, and I mean, we just touched on it before we got onto these questions. In terms of how long, that depends, you think, on how the sort of arc of the virus.
I think that's absolutely right. As you look at the economic disruption, why are share prices off today? It's because investors are calculating that companies are going to be able to make less profits going forward. They're going to have their workforces disrupted, they're going to have their supply chains disrupted. But on a long-term view, we would expect a virus to peak, and then off the back of that, you would expect business to go back to its operating model of before, and therefore largely make the profits it was making before, and therefore share prices should return over a medium-term view, certainly in the perspective of this viewer who's talking about a 5 to 7 year horizon, should return to normal. OK, Kishan, back to the medical side of all this. Please explain the risks for pregnant women. That's Hannah on Twitter.
Sure. So I can completely understand how Hannah, as well as many other pregnant women across the UK, are potentially concerned. What I would suggest is that they should follow the advice of the Chief Medical Officer, Professor Chris Whitty, who you'll have seen on the news conference that's just been happened, that is saying that there is a slightly increased risk for pregnant women and more personalised health advice will be coming out over the next 7 to 14 days. So I've seen some criticism of the media in terms of hyping this up and trying to panic people. However, I think that's very unjust and unfair, because if you give no information to people in the social media environment that we live in now, people will just make rubbish up and rumours up, and that is actually more harmful. So my advice to Hannah would be there's a slightly increased risk, as per what the Chief Medical Officer has come out with today, and everybody should be following him on Twitter and the advice that he issues. but they will be getting personalised advice over the next 7 to 14 days and should look out on NHS, the website for nhs.uk, as well as the World Health Organization website, who.int, which is absolutely vital resources that I'd encourage people to go to. And the one positive thing I think social media companies have done is when you search coronavirus, before you get met with the rubbish in the comment section, you get directed, or the opportunity to be directed to the NHS website, which I think is great and a positive step. What I would like to see on NHS websites is video clips from the news, short sound bites that are easy for people to digest and will put them at ease.
But the broad advice that this is a virus that affects disproportionately elder people, that hasn't changed.
No.
That's still the case.
No, that is still the case, very much so. And elderly people with pre-existing complex diseases do have the potential to get more sick. That's why we must take it upon all of ourselves to take the steps necessary to prevent the spread as far as possible.
Yeah, OK. Back on the economic questions, we were asking, should people panic? Someone asks, is this a good buying opportunity? I mean, there will be those, I suppose, as the market just plunges, to be thinking about that.
If you're a professional investor, you might think you want to time your entry into the market in terms of when you put money into shares. But for the vast majority of your viewers, the sensible thing to do is to drip feed money into the stock market over time. It's not to try and call the bottom of a cycle, because very many smart people over many, many years have tried to do that and lost fortunes. It's not a sensible way. Over time, the most sensible thing to do is to even out your luck by dripping it in each month, each quarter, and kind of trying to put the emotion of the headlines on days like today. It's very hard, I acknowledge, but try and put those to one side.
Yeah, it's a very difficult time for the elderly because of the health side of this, and then they see the value of their pensions falling like this. So, Kishan, another question from Twitter. How unwell are confirmed case people? For example, is it standard flu or are the symptoms similar, or are all requiring significant hospital treatment? I guess it just depends from case to case.
Sure. So, I mean, it's quite a complex question. There's lots of little bits in that, so we'll try and unpack it. In terms of how unwell are the confirmed case people, if they're talking about the people that have sadly died, then they're people that have had pre-existing medical conditions. In terms of the other confirmed cases, it could be a case of it could affect you or I, and it would affect people across the population in very different ways. I think in terms of is it standard flu, no, this is a new virus that has come into the world, and it is not the same as pre-existing flu. So things like flu vaccines will not be effective in this particular strain yet. Whilst it's not going to help yet because we need time to work on the vaccine, the importance of vaccines cannot be underestimated. Vaccines save lives. So the anti-vaxxers on Twitter, and I'm sure I'm going to get a lot of them now, but I think we need to use the media to educate people about public health and risk. And they don't all require significant hospital treatment. And the really important thing for this question is the vast majority of people with minor cases of flu-like symptoms should not go to hospital. And that sounds harsh, but the reason is that what we don't want to do is put undue stress on the health system, because if there is a confirmed case, then that healthcare system will be shut down, deep cleaned, people and staff have to go into isolation. So it's really important for your viewers, if you have minor symptoms, you stay at home, you dial 111 and you follow their advice.
Yeah. But the government's saying today they do want to test
potentially
those with some sort of pulmonary
and the respiratory type symptoms. They're talking about extending the testing.
Yeah, but that's to find out, try and find out a bit more about how many people have actually got this.
Yes.
Simon, again on Twitter, the government has given no guidance to businesses whatever. What do we do in cases to protect ourselves? I assume whether they mean themselves physically or their businesses. I run 2 businesses. How do I protect my staff and die?
Well, the first thing to say, there is a lot of government advice out there. It's on gov.uk, and then there's the health advice through the Chief Medical Officer. I think perhaps the question will be sort of focused to me from the perspective, how does he keep two businesses running at a time when we're being given advice around isolation, home working, trying to encourage or limit the spread of this virus. And in that regard, if he's running two businesses, or if he or her is running two businesses, I would suggest that they explore the ways in which they can be flexible, because none of us know, from a medical standpoint, from an economic standpoint, how it'll evolve from here with any great certainty. And therefore, providing the flexibility to adapt is probably the best way he can protect his business in terms of still serving his customers and still making sure he or she can produce for his clients over a protracted period of time, regardless of what the disruption looks like.
And just on this issue, what can we expect the government to do? I don't mean in terms of businesses necessarily. I mean, after a market collapse like this, can we expect any government intervention?
Yes, we can.
To try and stem the sort of worst effects of this?
Well, we do have a budget on Wednesday, and the Chancellor Rishi Sunak will make a statement to Parliament around what support the government will provide to businesses and also to households, potentially on increasing the eligibility to statutory sick pay for those in the gig economy, for businesses in terms of providing advice, support in terms of cash flow, and instructing HMRC to be much more cooperative with allowing them longer periods of time in order to pay their tax bill. But then we've also got the Bank of England. The Bank of England potentially cuts interest rates this month, and for a lot of people with mortgages,
still pretty low, aren't they? Already?
At 0.75%, they're potentially going lower, and also providing forbearance advice to lenders to not draw in credit to solvent businesses.
Right, OK, we're riding two horses here, economy and health. So, Kishan, just a last word from you.
I mean, on that point with the budget and Rishi Sunak, I think he's saying that NHS will get everything that it needs, and I hope it does in terms of resources. That's really important. Your viewers will know that I've been on for many years talking about it's been run down and there's been problems. One potential thing that should be looked at is we're getting people having to retire early as a result of the pension tax and the taper. So these are consultants that are not at risk. Rather than calling old consultants back that are 60, 70, 80 and long retired, these are people in their 50s that might be retiring. So I'd implore the Chancellor, if he's watching, to have a look at that and think about it, and give as much support as possible to the people in the NHS on the front line. Yeah,
well, I'm sure he is watching, so he's heard what you have to say. Kishan, thanks very much, and Simon, thank you to you too. Thank you. Well, one of the economic side